Today we will see about epidemiology of chickenpox. Before going to the epidemiology, let us see what do you mean by epidemiological triad. Epidemiological triad includes agent, host and environment. Agent is nothing but it is a causative organism, and host is susceptible host, that is where it's a source of infection or where the microorganism lives, and environment is the one which brings the agent and host together. Now we will see what do you mean by chickenpox. Chickenpox is an acute, highly infectious disease caused by varicella zoster virus and characterized by vesicular rash accompanied by fever and malaise. We know it is a acute disease which is an infectious one, and many would have got chickenpox. So suddenly, maybe within 2 to 3 days, you will get it. That's why they say it is an acute infectious disease, and it is caused by varicella zoster virus. What are the epidemiological determinants? First, we will see agent, because we know the epidemiological triad includes agent, host and environment. Agent, it is the causative agent. Chickenpox is caused by VZ virus, means it's nothing but it's a varicella zoster virus, which is also called as human alpha herpes virus 3. It is a heat liable one. Outside the host, it survives only for very few hours, and we know that if at all the people get attacked by chickenpox virus, means it gives a durable immunity. Next, we'll see about host. What is the susceptible host? Usually it is very common among children under 10 years of age, and adult, any age group, they can get it. Also, 0.4 to 2% of children born to mothers who had this varicella zoster virus during the first 20 weeks of gestation, that is the first trimester, they have the chance of getting chickenpox. What do you mean by environmental factors? This chickenpox is usually it is a peak during winter and spring or in coolest, driest months in the tropics. Coming to the incubation period is nothing but it is the time period between the entry of microorganism till the clinical manifestation. So usually it is 14 to 16 days. And how it gets transmitted? Mainly it is a personal contact, that is person to person, it is a direct contact, and usually it spreads through droplet infection. And how the microorganism enters the body means mostly it is through respiratory tract or conjunctiva. If the pregnant mothers, they are exposed to chickenpox, means there are high chances that virus can cross the placenta barrier and infect the fetus. What is the infective period of chickenpox? 1 to 2 days before the appearance of the rash and 4 to 5 days afterwards. And the virus usually it dies before the pustula stage, because there are various stages we have in chickenpox that we can see in the later slides. Once the lesions are crusted, the patient is not infectious. What are the phases of chickenpox? We have 4 phases: incubation phase, prodromal phase. The prodromal phase is nothing but pre-eruptive phase, that is before the eruption of the rash. It is called as prodromal phase. Xanthum phase, it is also called as eruptive stage, and the last phase is the convalescence phase. First we will see pre-eruptive stage, that is prodromal phase. So here in the definition itself we have seen it is an acute, highly infectious disease. So it is a sudden onset, and mostly it will be starting with mild fever, shivering, malaise. And in adults, this prodromal illness, it lasts for 2 to 3 days before the rash appears. So this is about pre-eruptive stage. It is also called as prodromal phase. The next stage is the eruptive stage, that is it is also called as xanthum phase. Rash is the first sign which appears on the day when the fever starts. Usually the rash, it begins as a multiple small red bumps. We call it papules that looks like pimples or insect bites. So we may mistake that it is sometimes we mistake that it is a insect bite. So these lesions are small and have a erythematous base with a diameter of 5 to 10 millimeter. So after 12 to 24 hours, that means after a day, the spots typically become, it will have itchy, and usually vesicles will be found. Vesicles is nothing but the fluid filled bumps, which is called as vesicles. This will be continue to appear in crops for the next 2 to 5 days. So the rash, very peculiar one is it will have itching, and usually the calamine lotion or cool bath that may help to manage the itching. So the first phase is the pre-eruptive stage, that is also called as prodromal phase. The second phase is the eruptive stage, that is also called as xanthum phase. Next we will see about features of rash. So there are 3 features of rash. The first one is distribution, and the second one is rapid evolution, and the third one is pleomorphism. So first one, distribution. What is the unique distribution of chickenpox rash? It is symmetrical, centripetal. That means first it appears on the trunk, and then face, and then arms, and then legs. The mucosal surface also will be involved. Palm and soles, usually it will not be affected. Then the second feature is the rapid evolution. Suddenly, as a rash advances through the stages of macule, papule, vesicle, and scab. So these vesicles filled with clear fluid looking like a dew drop on the skin. So when we see the vesicles, it will be looking like a dew drop. Usually it will be superficial inside, and it is easily ruptured walls it will have, and surrounded with inflammation. The vesicles may form crust without passing through the pustular stage. And the scabbing begins 4 to 7 days after the rash appears. What is pleomorphism? That is the third feature of the rash. So all the stages of the rash simultaneously seen at one time. That is due to the rash appears in successive crops. So it is called as pleomorphism. And here the fever, what happens in chickenpox is the temperature rises with each crop of the rash. That is the specific feature. The fever or the temperature rises with each crop of the rash. So how we can diagnose? What is the lab diagnosis? So we can detect the varicella zoster virus. It's a DNA virus. Mostly it can be detected using polymerase chain reaction. So how can we control? We all know we can notify immediately to the nearby PHC, and isolation is very, very important, and disinfection of the articles whatever been used for the patient, that should be clearly disinfected. That should be very, very important. So what are the complications? The common complications are hemorrhage, pneumonia, encephalitis, and Ray's syndrome. It is nothing but the encephalopathy associated with fatty degeneration of the viscera, especially the liver. That is called as Ray's syndrome. And maternal varicella is common, that leads to fetal death and birth defects such as microcephaly, low birth weight, deafness, etc. And sometimes retinal necrosis, secondary bacterial infections such as streptococci and staphylococci are common. So these are the complications can occur after chickenpox. How we can prevent it? So we know that varicella zoster is the causative organism to get chickenpox. So varicella zoster immunoglobulin can be given within 72 hours of exposure. For children, to prevent, vaccines can be given between 12 to 18 months of age who had not had chickenpox. And again, the booster dose need to be given between 4 to 6 years, because this immunity duration is only 10 years. And always we should see this for children. If we give a nutritious diet, it is very, very important to develop immunity, and thereby they can prevent all the communicable diseases like chickenpox, measles, mumps, rubella, all that they can prevent it. Thank you.